You ask me why to build a HeartTeam. I think there is one main goal to achieve. We are all doctors, physicians. We try to have the best and the optimal treatment for the individual patient. And with the evolution of all the technology to address cardiovascular disease, we basically had the impression that all the specific knowledge of cardiovascular surgeons, the anesthesiologists, the interventional cardiologists and the imaging specialists need to come together to build a concept for the optimal treatment of the patient. So what we learned in the past is that every individual physician with his knowledge, he can bring important aspects for the treatment of the patient. So I think we should always keep in mind, if we work in a HeartTeam, that the main goal is to have the best optimal treatment. It's very important that we acknowledge that not one physician can cover the whole spectrum of the possibilities of treatment we have now in our hands. So we need to have the surgical knowledge, we need to have the interventional knowledge, but with time we see that imaging is coming more and more to a more important role, that plays a more important role to address all the different aspects of the anatomy of the patient, and then also the outcome of the treatment. Very important aspect if you build a HeartTeam is that you respect all the knowledge of the individual players in the team. You need to trust each other, because you need to imagine that you work together, that you're maybe together at the table, you need to treat complications together, and you need to have the same goal. It's not your individual goal to apply a specific technology, but it should be the main goal to have together an achievement, to come forward, to incorporate new technologies, and so to have an optimal treatment for the individual patient. And you need also to think of not just being in a HeartTeam before the intervention, but also during the intervention. You are together at the table, you need to trust each other. Maybe you need to treat a complication together, communicate all what you have done as a team, and so you can really be a trustful partner to your patient, which basically wants to have the optimal treatment. So what is the added value for the HeartTeam itself? I think this is also an important question for the members of the HeartTeam, because also they want to have an evolution, they want to learn from each other, they want to bring the new technology we have in our hands to the patient, so they want to have success, they want to be a good partner for the patient. So I think the HeartTeam is the perfect entity where you can learn from each other, but also where you need to share responsibility, where you need to respect each other. But in the end, together, the goal can be achieved much faster. So what brings the HeartTeam to the individual patient? I think this is an important question, because the patient wants to have the optimal treatment and he has no knowledge about the disease he's suffering from. So if you have a HeartTeam approach, the patient can address the individual persons of the HeartTeam, or the HeartTeam together can tell the patient, okay, we have had our board meeting, we looked at all the individual aspects, anatomy, risk, outcome, long-term treatment together, and one member of the HeartTeam can bring the message to the individual patient. What is the recommendation? What is the probable outcome? What is the long-term prognosis? The patient always realizes it's not a one-man decision behind. It was a team of experts discussing all the aspects of the anatomy, of the comorbidities, of the individual aspects, and then they came to the conclusion as a team. So this is a very important aspect, as the patient needs to trust into the decision making of the treating physician.